Welcome to Human OS Mind Your Health Rewired, the show that unpacks the hidden systems driving your symptoms and empowers you to heal from the inside out. I'm your host, Dr. Connie Cheung, and after decades of inside the healthcare system and outside of it as a patient, I've learned this, that health isn't something you chase, it's something you remember. And if you're ready to rewire your body, reclaim your power, and rise above the outdated health norms, you're in the right place. Let's get right to it.
All right, you guys, welcome everybody. This is Mind Your Health podcast. This is Dr. Connie, and today I have a very special guest. He is the co-founder and the CEO of CareYaya Health Technologies, and I love what he's doing. He's also a part of Counterforce Health. I can't wait to tell you all about this because this is something that is real in our world. All of us are experiencing it. My parents are getting older, and I too have some chronic illnesses that I have to navigate. And health insurance claims is a nightmare. So here we have Neal Shah, and I'm curious to know, Neal, first of all, welcome. I want you to tell us a bit and our audience a little bit about you and how you got into this work, both CareYaya as well as Counterforce, because I think you're brilliant it's really like you're problem solving everybody's problems. You know what I mean? So I love that.
Yeah, I'm problem solving problems that I experience myself, so thanks, Connie, for the wonderful introduction. I got into the work because I actually, up until my mid-30s, I was in the finance industry and I was a hedge fund manager. I started my career in investment banking very quickly, was good at it, went into hedge funds and became a partner at a multi-billion-dollar hedge fund when I was 27, and then started my own fund at 31 because I'd been generating really good returns and grew that from 10 million to 250 million by the time I was 35. Unfortunately, in my 30s, I became a caregiver suddenly. One, initially for my grandfather through dementia, kidney failure, and then end-of-life care. And it was a multi-year journey during which I helped with a lot of care coordination and care navigation. But really, we were very dissatisfied with the caregiving experience that we found, to the point where my mother just left her career to become a full-time caregiver. And at that point, I was still running my fund, so I became really obsessed with the care industry. And I was like, why isn't there better ways to get care? There's an opportunity of something that could be built to make social impact. And then, unfortunately, at the peak of my hedge fund career, my wife became severely ill and went through years of a difficult cancer battle, during which I became her full-time primary caregiver. And I ended up taking so many sabbaticals from my fund to manage her care, to the point where I ultimately just decided to shut my fund down and focus on her care, because I thought that would have a significant impact on her outcome and mortality risk. And, pleased to say, knock on wood, she had a successful recovery after 3 years and has now been in remission. So, very positive experience afterwards. We actually had our first child after the whole ordeal. So we have a happy baby daughter. Thank you. It was like a great journey. And then at that point, I was like, okay, I'm 40 and I'm in the middle of my life. And, I think just pure finance work, lost a sense of purpose and meaning. And I gained a sense of purpose and meaning in care, and just kind of care, healthcare, all these adjacencies of I'm not a medical doctor by background, so I kind of respect that we have an amazing healthcare system to get treatment, to get therapeutics, etc. But the social care system that we've set up in our country, as well as healthcare financing and all this, those are very difficult and nightmarish systems for many people to navigate. So I was like, okay, how can I use my skills and energy to help solve problems, within those fields, problems that I've experienced directly, and that I see so many others in years and years of being in support groups experience.
Wow. Yeah. So right now, tell me a little bit about, because you were telling me about two divisions of what you're doing. There's a focus on both sides of the coin. So tell us a little bit about CareYaya as well as Counterforce Health.
Sure. So our first innovation was CareYaya, which we started about 3 years ago. And there, the idea was, from our own care experiences of okay, people need a break. People who are caregiving someone through serious illness, through dementia, through cancer, etc., oftentimes need respite care, and they need just a nice person to help care for their loved one so that they can go to their job, they can kind of have a break, etc. And that care market is completely broken. It's typically high cost. In most markets, it's $35 to $45 an hour. And typically those companies' business models are they keep half the money and then they pay half to the caregiver. So it's low pay. So you have this result of massive caregiver workforce shortages because no one wants to do the work, the work is grueling and you're not getting paid that much, so you're not doing a great job. Oftentimes the workers are disgruntled, you as a family caregiver feel guilty, etc. And then you're paying top dollar for that. So we developed a new solution, which I learned through all the years of being in the caregiver support groups, which is healthcare students make for great caregivers. Pre-meds, nursing, physician assistant, etc. They make for great caregivers because they want to go into future clinical careers. So we built a platform that's similar to like what many call Uber of caregiving, where any family looking for care help can go on to CareYaya.org and within 2 minutes fill out a profile and information and then get into the system and get healthcare students near you to come help you. Best of all, it's the most affordable rates in the country. It's around $20 an hour, which is 30 to 50% lower than traditional care economy. We charge zero fees or markups. The whole thing is a social impact organization funded by social impact funders. Initially, I was just like bootstrapping it. And over time, we've gotten great funding from the AARP's Innovation Fund, American Heart Association, and other impact investors who love our work. And we are now scaled very fast. We're probably single-handedly running one of the largest care workforces in the country. We have 50,000 healthcare students across America on this thing. We're at over 30 different universities. Most of the top 50 universities in the country have a CareYaya presence. And these students are, these are our future doctors, nurses, physical therapists, physician assistants, occupational therapists. These are future clinical workers of society are going into the community and taking care of people. Most of the people we help are middle-aged sons and daughters who are caring for mom and dad with dementia and who just need a break, who need a companion around mom or dad so that they can safely keep their loved one at home and happy and healthy. So that's what we provide.
Can I ask you one question, though? What comes to mind, because I've been through this with my mother-in-law before, you're so absolutely right. But I'm curious to know, having been through the clinical model of education, and I have a lot of friends in the medical field, how willing are the students to jump in? Because like you said, it's grueling work on top of their academic, on top of everything. Like, I'm curious to know, how do you manage that time? Because a lot of the time we needed caregivers for the off times, like sleeping, early morning. Do you know what I mean? Like dinner times and stuff.
Hey, thanks for mentioning. The most popular care sessions on CareYaya are overnights. The second most popular are weekends. Why? Because if today somebody goes onto the site, and by the way, site is like very quick to use. So today's like Wednesday at 12 o'clock. If somebody goes to the site and books, I need somebody Thursday at 10 a.m. to 2 p.m. to hang out with my dad, that will get filled. But it might have to go to our AI will guess who's likely available, and it might go to like 20 or 30 students in the area before somebody takes it, because people might have Thursday classes, etc. But if something goes on there that tonight I need help from 8 p.m. until 4 a.m. or whatever, 6 a.m. because I need somebody overnight to stay with mom and dad so they don't wander, they don't fall, that literally there'll be a line at the door. All the students want to do it. So shifts are very popular that are at off hours. That's kind of interesting because it's like a different workforce than the traditional care economy, where like traditional care economy is mostly filled with middle-aged workers who are oftentimes single moms. They don't want to do the night shift. They don't want to do weekends, so there'll be surcharges for that. Students love doing that. Students are also available during the day, but they really love the nights and weekends. And is it easy to fill? Yeah, the students actually love the work. And that's the best part, that I feel that many of the students, they get opportunities to work at the hospital as like a CNA or a nurse aide.
I'm sorry, I'm just like, this your opportunity. You're giving them an opportunity. It's like clinical internship to kind of see. I mean, it is like the best human training, compassion training for likes of us, because we have to realize, like you're just training them on humanity and what it's like and what can happen at the end of life. So I think you're brilliant. I love so much of this.
Thank you.
And I probably will be using it for my parents as well.
Nice.
What I want to ask you, just a little question for me is, so it said AI, founded, like you're integrating AI into this. So AI really is the interface for matching the student to the care, the needed families.
There's a very sophisticated back-end analytics, which AI is like a buzzword right nowadays, but it's like machine learning and data analytics. But really, there is a lot of AI that is powering the ability of, if you think about it this way, the CareYaya team is 6 people. 6 people are managing a 50,000 person workforce in 15 different states. The traditional care industry Right? It's like crazy. I mean, it's like cool what you can do with technology and innovative thinking. And that's how you can deliver like very affordable care to a lot of people and pay caregivers more. Because these traditional care industry will say a staff of 15 people manages 300 caregivers in one city, right? So here you're using tech to streamline everything, booking, scheduling, onboarding, payments, etc. So yeah, there's a lot of like AI and machine learning on the back end that's powering the system and making a really good and robust system. But yeah, we're very proud of that because it ultimately passes through cost-effective, high-quality care to people who need it.
I love it. You're brilliant. Okay, so keep going with, I guess, you were kind of telling me about the CareYaya, and then I don't know where you are leading into.
Oh, yeah, so leading into Counterforce. So we've scaled this platform around the country, right? We have tons of people using it, and of course, anyone listening to the show, we'd love to help. You know, if you are taking care of an aging parent, often in another city or even in your own city, like we have now a presence across the country, and we're growing fast. And you know, if we're not in your area, we can be. So definitely reach out to me anytime. You know, I'm always available on LinkedIn or email, or I'll, you know,
where are you exactly? Where are you, demographic?
Our headquarters, we're in Research Triangle Park, North Carolina, so Raleigh-Durham area. So our first university we started at were Duke, UNC, and NC State. And then our presence, you know, I might miss some of these on the pod, but you know, people can check our website. But basically, our biggest markets are all the Washington D.C. metro area, all the Atlanta metro, New York City, Boston, San Francisco, Los Angeles, Dallas, a few others, like, and then one-offs like University of Michigan, Ohio State, things like that. But we're at like 30 out of the top 50 universities in the country, and growing pretty fast. So happy to expand. Yeah, thank you. And then, yeah, so through that work, actually, you know, to kind of like talk about like a different topic, like, which is like how people are dealing with insurance and just healthcare financing broadly. As in the years of running CareYaya, we noticed a lot of the family caregivers were like having a lot of difficulty with denials of claims for their mom and dad. And especially as a lot of people now are on Medicare Advantage plans, which are for-profit plans, which are notoriously have higher denial rates. So we started building internal tools, like again, AI system, to help people automate like the process of appealing denied claims, because we found that, believe it or not, 99% of people who have a denied health insurance claim don't appeal. But of the 1% who do appeal, about 40 to 50% of them win. So we're like, well, the goal is let's just make the appeal as easy or one click as possible, like the way Amazon made like delivering something to your house. You know, if you need a phone charger, you go deliver, you know, you click today and it's here tomorrow. So we're like, why don't we make the appeal process that way? Reduce the intimidation factor, improve the quality, ease the time. Instead of spending 8 hours doing all this research and parsing through medical journals and begging your doctor, you can just do it in 1 minute. So we built an AI tool for that, and people started using it and successfully winning appeals. And then we realized people weren't just using it for mom and dad's, you know, kind of stroke rehabilitation or anything like that. Many times people are using it for themselves, or they're using it for their kids. So as word of mouth spread, we just kind of created it into its own site. You know, it's called counterforcehealth.org. And we got this work grant funded through the National Institutes of Health and University of Pennsylvania. They have like an AI research lab that funds innovation like this to improve health. And it's now being used by thousands of people around the country. It's being used by clinics, which is really awesome. Like a lot of independent doctors, neurologists, rheumatologists, etc. Small hospitals are reaching out to us to collab. And we think there's just a huge opportunity because health insurance denials have skyrocketed in the last like 3 to 4 years. And I think I went down a rabbit hole in researching this and even wrote a book about this, but it's because the health insurance companies weaponized AI. You know, so I really think, you know, here I'll show you my book, but you know, it's called Insured to Death, you know, how health insurance screws over Americans and how we take it back. And of course the cover is meant to be provocative, you know, because like they are really, you know, I think that they're, you know, killing people by denying claims. And insurers have weaponized AI 3-4 years ago because this is a new technology that came out. And I don't think individual patients, small doctors, small clinics, like these people don't have these tools. So we're like, okay, we can build a tool and scale it to a lot of people and solve problems. And pleased to say Counterforce is helping tons of people appeal and winning. So, you know, people report over 70% win rates, which is amazing. So, yeah, so I think that, but I think it speaks to a broader crisis around health insurance. And, you know, I think it's a key part of the national conversation of like, what should health insurance look like? To us, it seems like if you get really sick, the insurance isn't really there.
Yeah.
Yeah.
So how did you get into schools? Was that medical, like to recruit the caregivers, right?
Oh yeah, to recruit, it was through professors. You know, so through professors and pre-health advisors, we had built relationships with a lot of healthcare focused professors, biology professors, nursing professors, etc. And then many of those professors also serve as pre-health career advisors. And what the professors feel that the students lack is ways to get enough experience during undergrad. Many of these students nowadays are doing what's called a gap year. So if you're like a pre-med or a pre-physician assistant, you might do your 4-year undergrad and then spend 1 to 3 years getting work experience before you apply. In the case of like programs like physician assistancy, they're requiring 1,000 hours of some sort of care work in order to be an applicant, and saying to be competitive, you need 3,000. Can you believe it? So like, there's no way anyone's going to be able to get that easily during undergrad. So they might have to spend 1 or 2 years post-grad to do that, which is like not a great use of their time or energy.
But so now they get paid for it and get great experience.
Exactly. Like the beauty of a gig economy flexible scheduling platform is that if you get on CareYaya like sophomore year or junior year, and you start picking up care shifts like here and there, and you're racking up 15, 20 hours a week, you're going to hit 2,000 hours before you graduate. So it makes you a really competitive applicant. Plus, you're going to earn a lot of income. And by the way, otherwise, you might have been working at your campus coffee shop, or you might have been doing, believe it or not, we did surveys before we launched. Some of the most popular things that the healthcare students were doing were DoorDash, food delivery, or they were doing Uber driving. So we're like, really, like, these are the popular jobs, like you guys want to go into the caring field, but there isn't a platform like that to enable you to do that. So we're like, okay, we'll build one. So it's been really cool to see.
Amazing. So amazing. Yeah. So nice. Tell me about like your experience with your grandfather, first of all, with the phases of, I guess the challenges you saw that kind of initiated the frustrations. What was the biggest frustrations during that path? Or
I think the biggest frustration was, so I was care coordinating from afar because I was like working and I was running my fund. My mom was managing the care kind of day to day. And we were hiring a lot of care agencies. And the biggest frustration was the way that entire system worked. I'd say, but I don't know which one is bigger, reliability of people or the quality and lack of social relationships. I think they're probably both equal. One, the reliability was terrible. We probably experienced, in any given week of care, at least 1 day a week, multiple hours late or no show, which is a disaster because my mom had to work. So, how could she, go to her job if unexpectedly somebody's just not going to show up or they're going to be 4 hours late? And I believe, and I did subsequently a lot of research on this, it's endemic to the care industry. There's only about an 85% on-time arrival rate. So that creates a huge problem when you have a working caregiver who needs to go somewhere in order to earn income and fulfill their responsibilities when it's that low reliable. So that kind of went into the back of my mind of, okay, I need to fix this. Pleased to say CareYaya has over a 99% on-time arrival rate. And it's like the students are very reliable, and we built a tech system with like very robust alerts and notifications and rewards and penalties for being late. But this traditional care industry has not figured that out. So I think that reliability was a major issue. But I think the bigger emotional issue was quality of the caregiver and lack of interpersonal relationships. Many of the caregivers there's a combination of factors. In the traditional care industry, they're trained not to develop too close of like a personal bond with the person they're caring for. So they view it as more task-oriented work. And I think there's a relational element of care that is grossly undervalued by the care industry. That, sure, somebody can do certain tasks, but I think that people really want to feel cared for. And I also think the family caregiver is trying to absolve themselves of the guilt that I wish I could do this, but I have to go to my job to make money. Therefore, this person's doing it. The worst thing is if that person doesn't care for your loved one, and I think that I felt that like in my bones, like the entire time, and it was like, there are some great people, but it was few and far between. The vast majority of people did not bring that vibe, and it sucked.
And when you do find somebody, I mean, us as a family watching, and you're right, the guilt is huge. Yeah. And then to see this person who cares very little, sometimes you don't know what goes on. It's almost like having a child being left with, and because I don't know what I'm going to do to my mother-in-law or what was going to be said, what was taken, because my mother-in-law doesn't remember anything. And so eat Did she get quality meals? And then when you have this individual, you're also at the mercy of that person. So you don't want to step on any toes with anybody. So you don't have a voice as a family member. Just 100%. Always like, oh, yes, please do whatever you want. Like, bow down to this. But you're looking at somebody who is technically task trained, not compassionate, which is really what my mother-in-law wanted and what we wanted for her. You know what I mean? Yeah,
100%. I totally agree. And I think that there's just like multi layers of like, you as a family caregiver feel guilty. The person needing care is resenting it, oftentimes rejects the care because they can even feel, even if they have like cognitive decline or anything, I still think people are people, you know, like they still know. I generally feel like, you know, I've been around a lot of people with like dementia, with serious illness, and you just kind of get a sense like, yes, science says this and this, but I still think like the soul is still there and aware, you know, and I think people know that this person doesn't really want to be around me, doesn't want to help me. And I think as a result, sometimes people can't express, you know, that, but they will reject the care in other ways. So I think that the quality of the relationship is very important, and the intention of the person coming in wanting to build a relationship. And I think that is something that the students like in our program are thriving on. And, you know, I think, so I really wanted to solve that, but that was like probably my overarching biggest frustration. And the reason we ended up just doing it ourselves is that after trying so many, it was just like, this sucks. You know, you feel guilty. And frankly, I went through it again during my wife's care. You know, my wife was severely ill for several years, and in and out of the hospital, multiple treatments didn't work, you know, ICU stay. At one point was in a medical coma for a month. And like at various other times, you know, I took sabbaticals from my fund to manage our care. But if I ever tried to get external help, that was the biggest point. You know, it's like feel guilty, like, okay, this is the person that's going to like help somebody after like a very difficult round of chemo. You know, the person doesn't even care really, or is like not empathetic. I think that matters a lot. You know, I think that in my opinion, the tasks are much less important than the relationship. Yeah. And I think that is grossly de-emphasized.
Honestly, Neal, this is something. Your grandmother had kidney failure. I had kidney failure after the COVID vaccination in 2021. And I didn't know how to be sick. And Neal, I had a kidney transplant, and then I had to take that transplant out. It was a failure. There's a lot of medical negligence. And what I can tell you is the physicians and the nurses that were taking care of me during those 4 years during COVID, lockdowns and everything else, it was very abusive. And if I didn't know any better, I'm a very knowledgeable person in this regard, and I know what healthcare is, but I just felt this sense of, wow, our healthcare industry is just tanked. But I love how you're solving this problem of aging population, because it's a huge social problem. Number two is our physicians needs to be a little bit more compassionate, and that's not
agreed.
It's not being trained. It's not trainable. But I feel like through your I don't know, hands-on deck kind of a training, it's a huge service to the medical industry or any allied health professional industry. And your parents, my family, my parents are going to get quality care from people who care. And then it's going to weed out those who just don't want to do this, which is also good. So good. I love it.
Agreed. No, thank you. Thank you for mentioning that. I mean, that's like a lot of the med school admissions people tell us that, you know, and I think that you're right. Like there's something, you know, we all as a society should question medical education. It's broken. It's completely broken. It's over prioritizing memorization and rote test taking and, you know, multiple years of
technician. We're
kind of like
technician.
Exactly.
We silo them, we tear the body apart, we specialize to get more money. If you think about the medical education that way, but let's talk about gears or switch gears a little bit about the health insurance industry. You and I both know, Neal, these claims are designed to be denied. And I mean, I love what you're doing. You're almost angelic to this society today because you know, you're fighting a system that is deeply ingrained politically. It is huge lobbyists and people in no medicine who is calling the shots on who's going to get paid and who's not.
Agreed.
I, as a healthcare practitioner, I already know they're in it to deny my claims. So for me 100%. To check my boxes as a technician in the hospital, all I have to care about is more documentation than the patient care. And I think that's a huge problem. Where do you see that going? Like, I want
I think
pick your brain about what you think
sure.
the future of this should be.
Yeah. I think. Well, I'll tell you both where I think it is going, and maybe separately where it should go.
Yeah.
Where I think it is going, in terms of just like the reality, is they are using AI and technology to drown clinicians and patients in paperwork and denials of claim, and then patients and clinicians don't have technology yet, so they're doing it manually, which is costing time and money, and then resulting in massive amount of burnout and moral injury, by the way, on the providers, right? So people are leaving healthcare in droves. So I think step number one is designing technology tools to what I would call arming the resistance of like, hey, if one person's using a gun and you're using a knife, you're going to lose. So, I hate to make the crude analogy, but it's like, okay, we need to arm you with the same weapon. So let's build AI for patients and physicians so it can be a fair fight, that people can actually use AI tools to rapidly and programmatically appeal. I think that's step number one, and that's like what we're doing right now across the country through Counterforce Health. Interestingly, there's a hack here. They can use AI systems, and if providers use AI back, it can just be AI versus AI. But if a patient involves themselves in the appeal, and the patient, whether they do it manually or AI, once the patient initiates appeal, the other side has to have a human review. So it forces them into a higher cost, and then as a result, it's more likely to get approved and less likely to be denied. So I think that's step number one. Step number two, and frankly, the reason I wrote the book and I put this entire like healthcare rights playbook in here and did a multi-step appeals process is that a lot of people don't know you have rights to external review. And external review is when you appeal to the state insurance commissioner, and they will convene an independent board, depends state by state, but independent, kind of retired doctors or other people from the community that are independent of you and independent of the insurance company to review and adjudicate. Majority of patients win external review. A lot of people don't know that. So, I wanted to kind of empower people. And of course, third is litigation. If it's a major issue, you can take them to court. Majority of patients also win. So I wanted to kind of like, how do we streamline that entire process as fast as possible and as easy as possible for patients so they can take the power back? Now, on a darker side where I see it's going, I'll say where I see it's going and then where I think it might go in a positive way. I see they are pushing even more AI now. Even Medicare, which classically does not deny that many claims, is now starting in January 2026 under the Wiser model. They're going to start using AI for prior authorization. So Medicare is going to start having denial rates. So I think that the adoption of technology and, what they would call it kind of like cost management or whatever, but is really just programmatic denials, is accelerating. Cigna and Humana, as of October 1, just last week, rolled out auto downcoding. So if you have like a level 4 claim at like your primary care doc where you went in with hypertension and diabetes and it's like level 4 or level 5, they're automatically downcoding to level 3, like programmatically. And then you have to file paperwork to prove that you did that to move it back up. So AI is flooding this on the other side, and patients and doctors are going to need it. Where I see the opportunity is I actually think the entire healthcare and health insurance kind of complex is starting to break, and a lot more people are going direct pay. And I really see my kind of call would be, let's just dismantle the entire health insurance system. Let's just go direct pay, maybe HSAs, and then government can use the money it's saving on this to perhaps direct fund HSAs for lower income people and for senior citizens. But otherwise, everyone can kind of like manage their own care directly. I think that's a better model for everyone.
Ultimate $1 million question. How can we, as consumers, kind of add to going in the latter direction that you just said, going direct pay?
I think there needs to be, great question. And I've been thinking about this a lot. So please hit me up on LinkedIn or anything if anyone's listening. But I'm trying to like build a movement to kind of push this. Like, we have a great opportunity here. 2026 midterm elections are coming up next year. This is not a left or right issue or a Democrat or Republican issue. This is a bipartisan issue because the insurance lobby is bipartisan lobbying, right? So we need to build a massive movement of patients and providers, try to sponsor people to run for office or force existing people who are running for office in the midterms to answer these and push for a direct pay solution. But I think we need to kind of gather together and unite and put pressure, because I think the number of people who are frustrated by the system grossly outnumbers the number of people who want to perpetuate the status quo, but those people have currently money and lobbying power.
Yeah. Hey, Neal, I love it. I love your brilliant mind. I want to remind you that you're on a time crunch right here. So I just want to kind of finish up right here. I want to be a part of this movement. I for sure will go ahead and reach out and get in touch with you. I live in Georgia, so you're not that far away from me.
Nice.
And I love what you're doing, Neal. So I just want to keep in touch as colleagues and kind of people with the same vision. I have so much to share with you on the other side of this because as you were talking, I had so many ideas come up. But anyway, where can people find you? I know CareYaya.org, and then there's counterforcehealth.org, and then there's Neal Shah on LinkedIn. You share a lot of information. And then you also have, we didn't talk about Uprising Show, theUprisingShow.com. I'll include all these things on the show notes, you guys.
And TikTok and Instagram, also feel free to find me on there.
Neal
too.
Shah? Neal Shah?
I'm on both. TikTok, I'm Neal K. Shah, like Neal, middle initial K, and then Instagram as well. I'll email you those links. I've actually found TikTok to be an awesome platform. I've recently become very active on there, and it's awesome to see.
I love it.
People are pretty engaging.
You're going to get the younger generation. I hate TikTok, but it's part of business. Neal, I just want to say thank you so much for what you're doing. We love what you're doing. I'm so happy your wife is okay. Tell her I said hi. And Neal, we will be in touch because I think you're brilliant. Right? Well, we will definitely promote this and with all the people that I know. Yeah.
Cool. Thanks so much, Connie. Great chatting.
Thank you. Bye, you guys.
Thank you. Bye. Bye.
Thanks for tuning in to Human OS Mind Your Health Rewired. If something you heard today sparked a shift, share it with someone you love or tag me at Dr. Connie Cheung so we can spread this mission together. To explore programs, trainings, or resources to support your healing, visit hossystems.com. And remember, you're not broken. You're brilliantly wired for healing. You just need the right operating system. Until